My name is Manuel Roman Lacayo. I am the Associate Director for the Center for Latin American Studies at the University of Pittsburgh. On this, the 24th Latin American Social and Public Policy Conference, and the first virtual version, and we hope the last exclusively virtual version, it is really a pleasure to welcome the speaker and the person for whom the keynote address is named, Carmelo Messalago, and the Distinguished Latin American Social and Public Policy Keynote Address. This year, we're also privileged to have Dr. Ariel Armony among us. He is the University of Pittsburgh's Vice Provost for Global Affairs and the Director for the University Center for International Studies. From there, he also holds faculty appointments in the Graduate School of Public and International Affairs in the Department of Political Science and the Dietrich School of Arts and Sciences. He will join us to do a proper introduction of this person we are honored to have among us with his talk about 4 decades of Social Security in Latin America. So without taking any more of your time, I will just hand you over to Dr. Ariel Armony. Thank you.
Thank you, Manuel. It's a great pleasure to be with all of us. I want to start by thanking the team at CLAS and the Student Organizing Committee for putting together this fantastic conference. So today I have the honor of introducing our keynote speaker and my dear friend, Professor Carmelo Messalago. Dr. Mesa-Lago is an internationally prominent scholar, professor, and mentor in the social sciences and the Distinguished Service Professor Emeritus of Economics and Latin American Studies here at Pitt, whose scholarship on Social Security and Cuba's economy is recognized worldwide. To quote former President of Chile, Michelle Bachelet, Professor Mesa-Lago is a social scientist that has been able to combine the academic work with the practical labor of improving Latin American society for half a century. It's really hard to resist the temptation to list Professor Mesa-Lago's extensive catalog of accolades, research, and teaching, but I only have a few minutes. Carmelo's close to 400 publications have appeared in English, Spanish, Portuguese, French, Chinese, and Japanese in 34 countries. He has conducted research in more than 190 institutions in 45 countries across the globe. He holds the International Labour Organization Prize on Decent Work, shared with Nelson Mandela. They say that when a professor retires, their work slows to a trickle. Well, with Carmelo, it's the complete opposite. His productivity and number of publications actually increased when he retired. His over 50-page CV, much of which is from his retirement years, speaks to that. But his continued work is also a testament to 6 decades of dedication to his pioneering work in research and policy implementation that has created tangible social change in favor of humankind. His role as a teacher has had a multiplying effect over the decade. One is struck by how often scholars talk about Carmelo as a mentor and professor who gives a sense of mission and service to his academic studies, which makes him truly unique. At a recent event, a former student highlighted Mesa-Lago's humility and generosity, traits that have been underscored by many of his former students from around the world. Dubbed a scholar and intellectual of the first order by Nobel laureate in economics Alvin Roth, Professor Mesa-Lago is one of the most visionary intellectuals worldwide. Carmelo has expanded the boundaries of an academic structure often marked by the lack of diversity. As we welcome him today, we also recognize his extraordinary contributions to the global and Latinx intellectual communities, and the years he has been and continues to be a role model for many in the US academic community and around the world. As an immigrant, Carmelo is an inspiration to all of us. Finally, we are delighted that Carmelo has been selected to receive the 2020 Chef Distinguished Faculty Award for International Achievement in recognition of his influential work across the globe and strengthening of Pitt's profile at home and abroad. So please, help me welcome a person I'm honored to call my friend and whom I deeply, deeply admire, the Dean of Cuban Studies, the Master of Social Security in Latin America, Professor Mesa-Lago. Bienvenido, Carmelo.
Muchísimas gracias, Ariel. Es buenísimo tener amigos como tú. Muy generosa tu presentación y también muchísimas gracias a todos los que han trabajado tan duro en clase para organizar esta conferencia. Entonces, el tema, como ven ustedes, is an evaluation of performance in 4 decades of pension privatization in Latin America from 1980 to 1920. And I am going to contrast promises made by the reformer with statistics and other evidence. Between 1980 and 2008, 11 countries shifted totally or partially from what we call public pension systems. They are characterized by defined benefit because it's regulated by the law, pay-as-you-go, or a collective partial reserves and public administration. And then we call private pension programs those that have a defined contribution because theoretically the contribution is fixed and doesn't have to increase as is in the case of public systems through time. They also have a fully funded capitalization through individual accounts which are owned by the insured, and administration is by for-profit corporations that also theoretically compete among themselves. So here you have the 11 countries. They are ordered by the year of implementation. The first one, of course, was Chile under the dictatorship of Pinochet. And I am going to distinguish between 3 models of this privatization process. The first one is substitutive, which you can see is Chile, Bolivia, Mexico, El Salvador, and the Dominican Republic. In this model, the public system is completely replaced by a private system with the characteristics that I summarized before. A second model is a mixed, and you have it in Argentina, in Uruguay, and Costa Rica and Panama. And in here, the public system is converted into a first pillar in this mixed system, and a second pillar, which is a private, the private model, is added, and the insured at the time of retirement collect 2 pensions. Usually, the most important pension, the major one, is received from the public pillar, and then a supplementary pension comes from the private pillar. And finally, we have something which is unique for Latin America, which are parallel models. Those are only in Colombia and Peru. And the public system continues. In some cases, there is a reform to make it more viable financially in the long run. That's the case of Colombia. And then a new private system is added, and they compete among themselves. and with some restriction, they can move from one to the other. So these are your three models and 11 countries. And the latest reform was in Panama, as you can see, in 2008. There have been no structural reforms after that. There was an attempt in Brazil by President Bolsonaro, but it failed. Because of the problems that I am going to demonstrate in this presentation, which is a summary of a book, by the way, and you can get a copy either in English or in Spanish digitally. It's available. The Spanish is already published, and the English will be published by the end of April. Because of the problems that I will prove, several countries, 4 of them has what we call reforms. And there are 2 types. The first one, it happened in Argentina and in Bolivia. In this type, the private system or pillar system in Bolivia, the pillar in Argentina, they are closed, and all the insured and the funds are transferred to the public pillar. So there is no private system anymore in these 2 countries. Only 9 are left with partial or full privatization. And then in the case of Chile and also El Salvador, the private system continues, but with a significant difference, which is that in Chile, the reform improve several of the aspects or principles in the system. On the other hand, in El Salvador, the major concern of the government was to reduce the fiscal deficit, and there was no improvement in those principles of aspect. Yes. So what I am going to do is to evaluate the performance of these 9 private systems in the period from 1980 to 2020. And I am going to do that based in 5 key aspects, which are based in the International Labor Organization principles that have been shaped since it was created in 1919. The first one is coverage, and I am going to measure what is the coverage of the labor force or the economically active population, and also the elderly population, those age 65 and above. The second principle is social solidarity and gender equity. The third principle is benefit sufficiency or adequacy. The fourth is efficient administration in reasonable managerial costs, theoretically through competition. And finally, the last one is financial and actuarial sustainability. Most socially developed countries are Uruguay, Chile, and Costa Rica by that order. Then we have intermediate countries, Panama and Mexico. And finally, the least developed countries are Colombia, El Salvador, Peru, and Dominican Republic. The first promise from the privatizers was that contributory coverage will increase. They didn't mention at all non-contributory coverage. Okay, what I am going to do here is to compare, well, first of all, between the creation of the private system and the year 2004, coverage of the labor force declined in all the countries without exception. I have demonstrated that in one of my books. After that, there were increases in coverage of the economically active population, and you have here between 2009 and 2018. All this is based in household surveys, which are comparable among not only the private system, but the public systems as well. Now, what you can see here is that there was an increase in coverage. And if you look at the first 3 countries, which are the most developed, coverage increase and oscillates between 65 to 70%. Then you have Panama in the middle with 50%. The remaining 5 countries, which are the least developed, except for Mexico, coverage fluctuates between 38% and 21%. This is quite important because the International Labour Organization, in its minimum norm, sets a minimum coverage of 50%. So these 5 countries are below the minimum of 50%. And not only that, it is extremely difficult to extend a coverage in all of them. You can also see that in the case of Mexico, there was a decline in coverage from 32 to 30%, and in the case of El Salvador, there was a stagnation. Now, why we have this different performance in terms of coverage? Why some countries have been able to achieve a high coverage and others very low, stagnant, and difficult to expand? There are 2 major reasons. The first one is the percentage of the labor force which is informal, in the informal sector. Usually they don't have an employer. It's very difficult to detect, register them, and collect their contributions. And so as more developed a country is, less is the informal sector and vice versa. So these countries that are below 50% of coverage, they have very large informal sector. It's extremely difficult for them to expand coverage. The second reason is that the system, the private system, has been unable to adapt to the transformation or to the structure of the labor market. And this is very important because privatizers for some years now have blamed a reason which they say is outside of the system, which is informality. And I show in the book that are many successful cases of countries that have been able to expand coverage to the informal sector. Now, the second degree of coverage that is measured here is of the elderly, those who are 65 and above. And I am combining here both contributory coverage and non-contributory coverage. These are usually social pensions that are given to the poor. And I am comparing again 2009 and 2018. And as you can see again, the most developed countries have the highest coverage, as much as 90% in the case of Chile, 87% in Uruguay. Then you have Panama and Mexico, anywhere between 75 and 81%. And then you have the least developed countries in which, particularly in the case of Dominican Republic and El Salvador, they are below, well, Peru as well, they are below the 50% minimum set by the ILO. And there have been increases in 7 countries, but there have been a decline in the case of eventually there have been a stagnation in the case of El Salvador. I just said that the Dominican Republic doesn't have non-contributory pensions. The law, the reform law of 2003 established that program. They should have enacted the non-contributory program, but all these years have passed and they have not implemented the non-contributory pension. And in the case of El Salvador, they do have it, but it's stagnant, and therefore there is no increase in that coverage. So let's go to the second Social Security principle, which are social solidarity and gender equity. The problem is there was no promise of the structural reform. They didn't mention this. And the reason is that in a private system, the insurer is the owner of the individual account. where his contribution or her contributions go. Those are invested by the administrator. Those are the basis for the future pension. In a public system, on the other hand, you have solidarity, social solidarity, because you have transfers among generations. So the old generation helps to finance the new generation, the young help to finance the pension for the elder people. There are transfers also among genders. Generally, there are transfers from men to women, and also transfer among income groups from the highest to the lowest. That doesn't happen in a private system, therefore there is no social solidarity. So we have elements of social solidarity, but are not from the private system. They are external to the private system. They are financed by the state. So this is not internal solidarity. This is exogenous solidarity. And you have some examples here of how the state have intervened in order to provide some social solidarity. The introduction and expansion of non-contributory pension targets on the poor that I have explained, except for the Dominican Republic that doesn't have it in operation. There are also state contributions to improve low contributory pensions. They set a cap on that, and after the cap, then that state contribution stops. And we have this in Chile, Mexico, and Uruguay. And finally, there are inclusionary measures in the contributory program for some groups previously excluded, particularly those in the formal sector in several of the countries. Concerning gender equity, there is no gender equity either. Actually, the private system accentuates gender inequality. This inequality is induced both by the labor market and by the system itself. By the labor market, because women have a lower participation than men in the labor force. They are paid a lower wage for equal work. And finally, they leave the labor force to take care of the children, to raise the children, and also to take care of the sick people and the elderly. And they don't get any remuneration for that work, and therefore they don't contribute. They don't contribute as much as the men do, and therefore their pensions are going to be lower, because in an individual account, this is what will determine what you accumulate there, what will be your future pension. And finally, quite importantly, the pension is calculated with mortality table that will estimate how long a retired person will live after retiring, because the women live 4 or 5 years longer than men. Then that pension will have to be expanded for a longer period through the mortality table, and that contributes to a lower pension of women. There is plenty of evidence in the book showing this. So that's because you get this inequality from the labor market, but also it's derived, or it comes due to the system itself. For instance, women often retire 5 years shorter than men, and that is a problem, because if you combine 5 years for a lower retirement, which they do not contribute, and 5 years of extra life expectancy, this is about 10 years, and that of course very badly affects the level of the pension of women. Now, we have seen that there is a light expansion of the private system in terms of coverage of the economically active population, but there is a very low annual average of growth. It's growing in most countries, but very, very slowly. On the other hand, I show that there is a very large expansion of coverage of female 65 and above, but that is due to non-contributory patients, not to the system, not to the private system. And finally, in some countries, in Chile and in Uruguay, they grant to the women either a voucher, which is deposited in individual account, and it earns interest, and then eventually when the woman retires, she gets this voucher at the interest, which improves the pension. Or in the case of Uruguay, you have 1 year of contribution for each child born alive. So these are measures that have been introduced in this private system to partially at least, or to alleviate this inequality. And here there was a promise of the structural reform. They promised they will be adequate, they will be sufficient. Actually, Jose Piñera, that was the Minister of Labor and Social Security under the Pinochet dictatorship, promised that the pension would be equal to 70% of the last salary. And we proved that this has not been fulfilled, not at all. Now, let me briefly explain to you what is a replacement rate, which I abbreviate as RR. This is a percentage that is applied to the salary. And that is what determines the pension. So as higher your replacement rate is, higher your pension is going to be. The Inter-American Development Bank published a comparative study with data for 2015, in which all replacement rate average are published using a method which is the same for all the countries to estimate it. And the average replacement rate in the public systems was more than 64%. On the other hand, in the private system, it was less than 40%. So it was considerably higher than in the public than in the private, contradicting completely the idea that the new private system will increase the replacement rates and the pensions. The ILO has set a minimum replacement rate of 45% of the average salary during the worker's active life. And five private systems are below that 45%. So they don't meet the minimum standard. And here are some examples from the country. In the case of Chile, for instance, the replacement rate is 34% of the average salary in the last working years. In El Salvador, there are no estimates of the replacement rate after the reform of 2017, but data shows that 59% of all the insured will get only the balance in the individual account. They will not get a proper pension. In Mexico, the replacement rate is 30%, well below the 45% of the ILO, and also between 64 and 70% won't receive a pension at all. In Peru, the replacement rate is 39% in the private system versus the promised 60%. And between 60 and 65% won't receive a pension. And finally, in the Dominican Republic, the replacement rate is 27%. And the insured in the lowest three income quintiles, that's the 60%, won't receive a pension. So the first principle is efficient administration and reasonable administrative cost. And one of the key elements of a private system is that there will be competition. And because of this competition, theoretically, there will be an increase in efficiency and a reduction in administrative cost. The theory is that these private administrators will be competing among them. and that the insurer will select or move to those administrators that are the best. How do you define best administrators? Well, they should collect the commission for administration which is lower or the lowest. The yield of the invested fund in the individual account will be higher or the highest. And then the pension would be also higher. What we demonstrate in the book is that is not the cause of why the insurer select administrators. Actually, the major factors are publicity and also salesmen that move the insurer from one to another administrator for a commission that is paid by such administrator. So they don't have anything to do with goodness of the administration, and that affects significantly competition. In addition to that, surveys all over Latin America have shown that the insurer have very low or zero knowledge about the key characteristics of the private system, and therefore, lacking an education, they cannot make a proper selection, and that affects competition, of course. So the conclusion is that competition has not worked at all, or it have not worked well. I am going to show you 5 indicators that prove that competition doesn't work. So in table 3, we have the first indicator, that is the number of administrators. The theory is that as more administrators are there, more competition will be. But of course, the problem is how the selection is done. The number of administrators is a function of the size of the labor force of the insurer in the market. As higher the insurer in the market is, more administrators. So Mexico have the highest number of insured and have the highest number of administrators. El Salvador have the smallest one and only have 2 administrators. Actually, there is a duopoly there. What the table shows is between the peak in the number of administrators and 2019, the number declined in all of them. For instance, in the case of Mexico, from 21 to 10. In the case of El Salvador, from 3 to 2. Actually, I predicted that this will happen. Of course, I will pay attention to what I said before, the structural reform of 1996. And there is no competition in El Salvador. The second indicator is the degree of concentration. As more concentration you have in the largest 2 administrators, less competition. And as you can see here, in 2019, countries are ranked from the least to the highest concentration. As you can see here, in 5 countries, the 5 countries at the bottom, concentration fluctuates between 68 and 100%. 2 countries have 200% because in Panama there are only 2 administrators as well. And then in the remaining 4, that fluctuates between 39% and 58%. Let's go to the third indicator. So here we are looking at annual transfers. What is the percentage of affiliates that in a given year, as an average, move from one administrator to another? Now recall that they don't move because of the goodness of the system, they move because of publicity and other reasons. But it's quite interesting that you can see here the bottom 5 countries, from Peru to Panama, percentage of annual transfers are between 0% and 1.6%, practically nothing. Even in the case of Chile, in which they have the longest private system in operation, only 5% of the total number of affiliates change every year. And of course, they don't change for the right reasons. They change for other reasons. Okay, now this is the fourth indicator. And what I'm comparing here, and unfortunately, this cannot be done with the 9 countries because there are a large variety of commissions. These are all the same, and the commission is based on the salary. It's a percentage of the salary. It's deducted from the salary. In the case of Uruguay, 15% is deposited in the individual account. Then 0.9% is for the administration commission to handle the old age program, and 2.48% is for the premium for disability and survivors. The combination of the administrative commission and the premium is 3.43%. And in order to measure how much the administrative cost is, we divide this total by the deposit in the individual account. That's what it costs. And by the way, this commission and premium in most cases is paid by the worker alone. In other countries, the employer contributes too. So the charge or the cost of administrative cost in Uruguay is 23%. And it goes to almost 30% in the case of Peru. So this is a very high cost. And more important than that, Nobel Prize Peter Diamond and famous experts from the London School of Economics, Nicholas Barr, have demonstrated that for each percentage point in commission, the future pension is reduced by 20%. Now you can look in here that the total in the case of Peru is almost 3 points. So there will be a reduction of 60% in the future pension. And the fifth indicator are profits. Administrators have significant profits. As you can see, I'm doing the comparison annual profit as a percentage of net patrimony of the administration. And I am comparing 3 points on time, first 2004, then the global financial crisis of 2007, 2008, and then 2009, which is the most recent year that we have the statistics. And you can see, except for the case of the Dominican Republic, there was very high yield or excuse me, profit of the administrators. Now, in Panama, we don't have data because it was the last program to be approved or implemented. And then we have what happened in the crisis. And as you can see, in all countries, during this very serious crisis of 7-8, there was all administrators continued to have profits. And finally was the year 2009. And in Colombia, Costa Rica, and Chile, the profit is between 12 and 16%. And then in the case of Mexico, Uruguay, Dominican Republic, and El Salvador, it goes from 20 to 48%. In the case of El Salvador, almost half is profit of the administrators in relation to the net patrimony. And so you have this AFPs or administrators have phenomenal profits, and they are able to maintain them even during crisis. And I will later on go back to this issue. So let's go into the latest, the fifth principle, which is financial and actuarial sustainability. The reformers make a lot of promises here. The first one is that the ownership of the individual account and the private administration will be incentive to punctually contribute to the individual account. The theory behind this is that because the insurer owned their individual account and has higher the accumulation in the individual account, higher the pension, the future pension will be, that will be an incentive to contribute punctually. Okay, let's go to the next slide. What I have done here is, this is a percentage of affiliates that contribute punctually between 1999 and 2019. We didn't have statistics, comparable statistics before 1999. As you can see, the peak in terms of contribution is in dark font. When you compare the dark font with the 2019, you see a decline in all 9 countries. For instance, in the case of Uruguay, it declined from 63 to 57.5. In addition to that, in all countries except for Chile, when you compare the first year in which we have statistics available, 1999, with 2019, there is also a decline in the contribution, in the affiliates that contribute. This decline is very, very large. In the case of El Salvador, we are talking about 42 percentage points. In the case of Mexico, 29 percentage points. So this promise that the workers, the affiliates, will contribute punctually is rejected by data, which, by the way, this data are published by the International Association of Private Fund Administrators. I mean, so that is an association that combines all private systems in the world, and that's from where the data comes. Okay, the second promise was that there will be an increase in the invested fund. This is the only of all the promises of the structural reformers, the privatizers, that have been fulfilled. So we are measuring this here in $1 billion, and the fund in the individual account as a percentage of gross domestic product. In the first one, what you see that in all cases, there have been a very significant increase. The largest fund accumulated was in the case of Chile, with $215 billion. Very closely follows Mexico. By the way, Mexico eventually is going to exceed Chile because of the number of people that are in the system, in the private system. And then it goes down, and in the lowest countries you have relatively small because you have less people, and in some cases also less time of the system operation, like Panama was the last one. If you measure it by the percentage of the GDP, you see the same thing. There are increases in all the countries. In the case of Chile, it's more than 80%. This gives the administrator, the AFPs in Chile, an enormous power. That means that 7 administrators are controlling 81% of GDP. And that power is not only in terms of, not only side of Chile, but also they have other companies that are in other countries, like in Peru, etc. And therefore, an enormous power concentrated in a very small number of companies. In the case of Mexico, however, it's only 16% of GDP, because of course the GDP in Mexico is much larger, higher than in the case of Chile. And then when we go down, as we saw with the absolute figures, the percentage is very small. It's only 1% in Panama. Now, the third promise have not been fulfilled. And they say portfolio diversification will be achieved. So we have a distribution. This is a percentage distribution, 100. And what we have done here is to show the highest concentration by instrument, and that is in dark font again. For instance, in the case of Chile, 43% is in external instruments in foreign companies, in other countries, stocks, etc. And 20.5% is in debt of financial entities. And if you combine those two, you have a concentration of 63%, which is the last column. And we have ordered the countries from the lower to the highest degree of concentration. You can see that in the case of El Salvador, that concentration increases to 90%. A higher the concentration, lower diversification is. The most important instrument is investment in the public debt. As you can see here, in 5 countries, it goes from 54% to 82%. Actually, in the case of El Salvador, the percentage in public debt is higher than when we have the public system. So there is no significant difference between this instrument having the majority of investment. The second instrument is external, and stocks, international stocks. And as you can see here, in 2 countries, it goes from 36, in the case of Colombia, 3, Peru 44, Chile 43%. The problem with this is that it's good to have diversification in other instruments, including foreign instruments, but when you have such a high concentration, like 43%, 48%, when there is a financial crisis, like in 2007, 2008, and also the crisis of pandemic in 2020, the fund declines very sharply. And therefore, the insurer cannot retire because the pension will be considerably lower. So there is a high volatility when you have too much invested in foreign instruments. And finally, I want to show stocks, national stocks. One of the promises of the structural reformers was that this was going to be the most benefit instrument, so that the privatization and the accumulation in the individual accounts will go into national stocks, and that will help to develop the stock market. But we can see here that in 4 countries there is 0. In three countries, 6 to 7%, and only in 2 countries is 11 and 13%. So it's also proven that there is no, the national stocks have not been the one that have gained most because of this. Now, why is this? The basic reasons that we have this concentration, particularly in public debt, is that most of these countries, particularly small countries like El Salvador, don't have a developed capital market in order to invest. And so they are forced to invest in public debt. In the case of Salvador, this was tragic because the government was paying interest that was well below the international interest rate for many years. So what happened was that the state was receiving very cheap credit, almost without paying any interest, real interest, at the cost of future pensions, because as lower the interest is, of course, there will be less accumulated for those yields in the individual account, and the pension will be smaller. In El Salvador, Chile is a different story because Chile, the capital market in Santiago was created by the end of the 19th century. In the case of El Salvador, the law regulating the national capital market was enacted almost at the same time of the reform. And of course, it's not magic. It takes time to develop this. And even after all the years of the reform, they are having this very serious problem. So that is a major reason. The final promise of the reformers is that the gross real yield of the fund investment will be very high. Now, let me explain this to you. Gross means, well, the yield is the dividend or the interest that are generated by the money that is invested. It is called gross because the administrative cost of the investment is not taken into account. If you were going to deduct administrative costs, the yield will be lower. And unfortunately, this International Association of Private Fund Administrators published the gross, which is overvalue. It overvalues the yield. It should publish the net, but it doesn't. And the second is real. That means that you have to be adjusted for inflation. If that doesn't mean anything, I mean, if you have very high rate of inflation, then your investment yield is going to be even negative if the inflation is higher than the nominal yield. Okay, so now we are comparing 3 points on time here. First, from the creation of each system until 1999. Second, again, the crisis of 2007, 2008, the global financial crisis, and then the last 10 years. Now, as you can see, at the beginning, the Dominican Republic was not in operation, the system, as we all have it. And they have very high yields in this initial period. And the major reason for this is that there was capital accumulation, but there were no instruments. Now, there were very few instruments to invest the money. And therefore, the prices were inflated and the yield was very high. That's why it was so high at the beginning. And now, when the crisis comes, except for the Dominican Republic, there is a decline in all in this 2 years in the yields, and in some cases, as you can see, in Chile, Peru, Uruguay, Chile and Peru, because of the very high concentration in foreign instruments, there are declines 20 to 26%. Okay, and finally, this is the longest recovery in the history, these 10 years. And well, all of them are positive, but in 5 of them, this yield didn't recover the yield of the creation to 1999. Five countries didn't recover that yield. They are below the yield. In 2 countries, they are basically the same. Now, I want to say something again. These declines in the yields only affect the insured because they cannot retire. If you get a decline of your fund by 20%, your pension is going to be very low. So you have to wait until the market recovers, the capital market recovers, in order to get a pension, which we have seen already, the replacement rate is very low. If you retire at the time of the crisis, it's even lower than the average that we show. But the company, the administrator doesn't suffer. We saw that during the crisis, most of them continue to have utilities, profits. So it's only the risk is only borne by the insured. There is a draft law in the Chilean parliament now, which forces the administrators, when there are negative yields, because there was a decline again in 2020. We don't have the data, but in 2020 it was a sharp decline again because of the pandemic and the crisis. So that draft law forces the administrators, when they have negative in the market, negative yields, to return the commissions to the worker. That's something positive because at least there is some compensation. So basically, there is only one promise that has been fulfilled among the many, some 8 or 9 of them, which is a significant increase in the in the fund, in the capital accumulated individual account. In terms of coverage, it declined in all countries after the reform, and then it grew later, but in the least developed countries, it covers only from 21 to 38%. And it's very difficult to expand it due to informality and the incapacity of the system to adapt to such obstacles. Among the elderly, there was no promise. It increased in all countries, but not because of the private system, but because of the non-contributory pensions financed by the state. Social solidarity, there was no mention of this in the promises, and it improved, but only again due to state policies such as non-contributory pensions, state contribution to improve low pensions, and inclusive measures. So this is external to the system, it's the state, which, by the way, one of the theories of the structural reform is that the state will play a subsidiary role. The market will be the most important one. The state will intervene only when the market couldn't solve the problem. Well, we prove in the book that the role of the state has been crucial, and without this role, the private system could not function. I cannot go into this, unfortunately, but it's very thoroughly proved. Okay, the gender equity, there is a slight increase in coverage of female concerning the labor force, but much more among the elderly, and that is due again because of non-contributory pensions that are exogenous to the private system. Benefits sufficiency, the promises were not fulfilled. The average replacement ratio rate in the private system is 38.8% in 5 countries, which is lower than the minimum of 45% set by the ILO, and most of the insured won't receive a pension. The efficient administration, unreasonable managerial cost promises were not fulfilled. The competition have no function in most countries. We have 5 indicators to prove this. First of all, the number of administrators have declined substantially, and concentration in the bigger 2 has grown or stagnated. There is a duopoly in El Salvador. Second, the annual percentage of affiliates that change administrators shows a declining trend, and in 5 countries oscillates from 0 to 1%. Third, administrative cost is high and usually sustained because there is no competition, and the discounts take from 23 to 30% of the deposit in 5 countries, reducing the future pension by 20% for each percentage point commission that is deducted. Profit as a percentage of the net patrimony fluctuates from 20 to 47% in 4 countries, and from 12 to 15% in another 4, and it continues even in periods of financial crisis. And then financial and actuarial sustainability, as I have said before, the only promise that has been fulfilled is a substantial increase in the capital fund, but giving significant power to a few companies in the country. Opposite to the promises, the proportion of affiliates that contribute have not increased. It has drastically fallen in 7 countries and stagnated in 1. The portfolio continues to be concentrated. There have been no diversification, particularly in state debt, foreign instruments, and by deposits. 0 or very little is invested in national stocks, contrary to a promise. And then the gross real capital return of investments in instructional system until 1999 was high. It diminished sharply negative in the 2008 crisis, and did not recover the pre-crisis level in most countries in 2009, 2019, and fell again in 2020, although we don't have data for all countries. And finally, the risk is only borne by the insured, not by the administrator. And one more thing, in the private system, there was a 3rd pillar of voluntary savings. And that was supposed to be a supplement to the pension these have had no success at all in the country where there is most this voluntary saving, which is Colombia, is 0.4% of GDP. In most countries, is zero or close to zero. Now, thank you very, very much.
Thank you, Carmelo. That was enlightening and, I'm sorry to say, also discouraging. We have a couple of questions, and as we started a little bit late, I will get right to them. We have Pablo Faret, who asked about your recommendation to deal with pensions for rural workers in Latin America. He says, well, they kept us fed during this pandemic, but they're typically excluded from public and private pensions, except in Brazil.
Manuel, rural pensions?
Right. He says for rural workers of Latin America.
I got it. Okay, as you said, Brazil has the most important program, but especially for rural workers. It's a very successful program. I have been able to increase rural coverage the highest among all the countries. We can measure coverage of rural workers through the household surveys. And what we see in all countries, except for Brazil, is that coverage of the urban sector is considerably higher than rural coverage of the labor force. Because most of these workers are independent, or they have a very low salary, they are not protected by the law. So you have to create special problem like the one in the rural workers in Brazil, in other countries in Latin America. There are some countries, however, that have coverage of wage earners in the rural sector, salaried workers in the rural sector, like Costa Rica, for instance. They have been able to increase coverage of the rural sector, but not as much, of course, as in the case of Brazil. So to make compulsory coverage of salaried workers in the rural sector, to create a special program for rural workers as in Brazil, and also to create a special program for those rural workers that are independent workers, that they don't have a salary. And there are several countries that have done that. For instance, in Ecuador, there is a program especially for peasants, for independent farmers that have been able to increase coverage. So there are positive experiences, but this is a major problem in Latin America that have to be confronted.
Great. And a follow-up question also from Pablo. He says, and I will read literally because I want to do it justice. In the process of reversing privatization, how could we eventually deal with the persistence of corporatist subsystems such as the armed forces, public servants, judiciary, and so on, that actually have good public pensions while the rest are trapped in the private system? This type of political economy dynamic was criticized by you in your seminal work in 1977, but it would be good to hear your thoughts on the current scenario.
Yes, that was a major issue in my book about the stratification of Social Security in Latin America, published so long ago. And unfortunately, it continues. In all countries in Latin America, the armed forces have a separate program, which is a privileged one, in the sense that they have easier entitlement conditions, more generous benefits, and almost it's a norm that the state subsidizes the armed forces. And the same thing is true in several countries concerning civil servants. For instance, in the case of Argentina, there are thousands of programs, because not only a state of the union, but also in provinces, in municipalities, etc., with the same characteristic, more generous conditions and state subsidy. These programs are usually bankrupt. I mean, they cannot be sustained in the long run because their revenue is impossible to cover these very generous benefits. And so the state has to increase the subsidy. And what is tragic, however, because of this, is that sometimes as in Chile, for instance, the armed forces subsidies from the state, although they cover only a relatively small number of people, they are higher than the subsidy that the state pays for the poor, pensions for the poor, which we're talking about millions of people. And this is even more cynical in the case of Chile, because the armed forces imposed the private system. I mean, there was no social dialogue. The political parties were banned, the trade unions were banned. There was no discussion. This was imposed. And then the armed forces, of course, they praise the system as being the best in Latin America and in the world, but they, of course, they accepted from the system because their private system is much better than the private system. So that requires a very important public discussion so that people will understand how this privilege system are taking away resources that should be allocated to other priorities of the nation. But you also have a political problem. In many countries in Latin America, the armed forces have a real power. So it's very difficult to go against them. There have been several proposals in Chile to incorporate the Chilean armed forces into the general private system, and none of them, of course, have passed in Parliament.
Okay, thank you. There's a question from Isabel Morales, and she refers to the way Uruguay and Cuba are countries with the highest rates of age in the region, but they have different pension systems. And so how would their possible structural reforms differ? And that is in terms of policies targeting specific problems within their pension system.
Okay, well, Cuba is the oldest country in Latin America. We are talking about in 2020, 20% of the population were above 60 years of age. And the next one is Uruguay. We're talking about 19% of the population are the elderly. So these are countries that have, according to the Economic Convention for Latin America and the Caribbean, they are the oldest countries in the region. And then there comes accelerated aging and so on. So these two countries have this very serious problem. I mean, it's positive that people live longer, obviously for human reasons, but you have to cope with the financial problems that create aging, because in a public system as the one in Cuba, but also remember, Uruguay have a mixed system in which one pillar is public and another one is private. So in these public pillars, the contributions from the younger helps to finance the pensions of the elder. As the country ages, those in the productive age, let's say from 15 to 59, decline. In Cuba, the whole labor force is declining, and this productive segment is declining, have been declining now for 3 or 4 years. So there are less and less people that can finance a larger, an increasing number of pensioners, of retired people. And in the case of Cuba, the deficit between revenues and expenditures peaked in 2008. It was 40% to be paid by the state. Then there was a reform, a parametric, not a structural reform, that increased ages by 5 years. I predicted this is not enough. It has to be higher because Cuba have 65 for men and 60 for women. You have to think that the United States is a younger country and have 66, and it's moving to 67. Therefore, you have to do another reforms. For 3 or 4 years, the deficit declined, but it's increasing again. In the case of Uruguay, the deficit there is about 11% of GDP, and is expected to grow by 2070 to 14%. So this you need to increase ages. By the way, the age of retirement in El Salvador is only 60 years for both men and women. It's one of the lowest in Latin America. The same retirement age than very poor underdeveloped countries in Latin America, like for instance, Honduras, Haiti, etc. And there is a commission in Uruguay that just finished several months of work, and one of the major recommendations that it's doing is to increase the age of retirement. And the problem with this is that this is a political issue. You may remember that in Greece, maybe 3 or 4 years ago, there were massive public demonstrations against a law to increase age of retirement because people don't want to do this. They don't understand that if the age is not increased, there will be no money to pay their pensions. I mean, the system will be bankrupt. So it has to be gradually increased. In some countries, what is being done, only a few of them, is that the age of retirement is tied to life expectancy. So as life expectancy increases, the age of retirement automatically increases too. And I think this is a good solution to the problem, but once again, technically it is. Politically, you have the problem not only in Greece, you have it in Russia, you have it in Spain, there are several countries, Italy now has 67 years, but it was difficult to do.
Okay, and we have time for one more question, Carmelo, if you will entertain it. We have a question from Luis Hernan Vargas, and of course he says, thanks, as we do all. I was wondering about the competition issue as the Chilean experience shows. Part of the lack of competition is in the demand side due to high information asymmetry, complexity, and lack of rational choices. The bid of new workers to ensure the viability of the new AFP due to high entry barriers on the supply side. How may you assess this topic? In other words, enhance competition for the demand side rather than the supply side? And then if you can, he would also like to hear your comment on pension fund withdrawals in Peru and Chile due to the COVID pandemic.
Okay, so you have two questions actually. The first one is competition, not only in Chile, but other countries. As you saw, the number of AFPs in Chile declines through time, and the trend is, the universal trend is a decline in the number through mergers and closures. Okay, what has been done in small countries, for instance, in the case of Costa Rica and Uruguay, is to create, in the case of Uruguay, one public administrator. In Uruguay, it's called a FAP instead of AFP. And it's the Bank of the Republic in Uruguay. And that have the highest number of insured. And it have increased the competition because this public AFP or a FAP have reduced the commission. And when they reduce the commission, it forced the rest to reduce the commission as well, which was, of course, positive. In the case of Costa Rica, it's incredible because there are 6 AFP, but 5 of them are public. One of them is the Costa Rica Social Insurance Fund, and then you have several banks, and therefore those countries with very small number of labor force and insured, they should add a public administrator. They should be with the same rules as the private. They cannot have special benefits. When I was member of the President Bachelet second pension reform commission in 2014, 2015, we approved 58 recommendations. And one of them was to create a public AFP. There was some discussion under the current presidency of conservative Piñera, but that didn't pass. They however, have increased they have created a contribution for the employer, because the employer didn't contribute in Chile and Peru. So they have to pay now 6%. And I mentioned also this clause that when the AFP has, there are negative yields of investment due to a financial crisis, they have to return the commissions to the insurer. So for this a small country, of course, El Salvador, it's only logical that they have at least one public AFP. And the second question is the withdrawal from the pensions. And of course, Peru is the worst case because first, by the way, legislators in some countries are zero responsible. They are demagogues. And so the first thing that they did in Peru was to allow for a withdrawal of 95.5% of the pension fund when you reach the age of retirement. And the remaining 4.5 is because you have to keep paying for the healthcare program. So they try to maintain the healthcare program, but that is the end, of course, of the private parallel private system. They tried to do the same thing in the public system, but that didn't pass Congress. And the reason was that the state have to pay $7 billion to all those who withdrew the funds from the pension program because there is no individual account. And of course, the state have to pay for that, and they couldn't do it. Then they passed another law allowing for withdrawal of 25% in order for housing, and then the 10%, another 10%. This is basically destroying the system, either public or private. The reason for a pension program is to accumulate funds in order to have resources when you cease working, when you retire. And they have completely overcome this objective in order to do this. And I can understand there is a problem of the pandemic and people are desperate. And some countries have approved measures which are much more reasonable to withdraw 10%. And in some cases, you have to return this 10% in an even period of time, so your fund doesn't diminish. And also, this is very important, there is a general distrust of GDP in most of the region. In the case of Chile, for instance, several years ago, there were more than 1 million demonstrators in the streets demanding the shutdown of the AFP. So because of the lack of trust, people say, okay, I am going to have a very low replacement rate. My pension will be very low, so let me take the money out. If you take your money out and you invest that money in a small business or something like that, then you will have some money when you become old. But if most of the money, in the case of Peru, shows it has been used for consumption, and therefore they will have a very good time for 1 or 2 years, and then they won't have anything. And I have said that the law should say if you withdraw your fund, later on you should not be eligible for a non-contributory pension. The state shouldn't pay you a pension if you don't have money in old age because that was for your own fault. I mean, you use the money. But up to now, that has not been approved in any country because it's a political problem.
Yeah, indeed. Carmelo, I know that at this time, there would be yet another round of applause were we to be live. Thank you very much for your keynote address, for the presentation.
Thank you very much. It has been a pleasure to be able to deliver this lecture, particularly in LASP. and this lecture with my name, that I am so grateful for a former student of mine that provided the funds for this. And I hope to see you next week at the time of the set International Award for International Affairs.
Yeah, no, indeed. And we're looking forward to seeing you again very soon. We hope that your time in warm Miami and is regularized with the electricity flow, etc. And un gran abrazo, Carmelo, de verdad. Muchas gracias. Ha sido un gusto.
Saludos a todos.
¿Cómo no? Ok.
Adiós.
Hasta luego.